Welcome back, everyone. Our next lecture is on dirty electricity, which consists of intermediate frequencies. But first, a polling question. Unlike electromagnetic fields and electromagnetic radiation, the amount of research on the health effects of dirty electricity is limited. We have one study documenting a cancer risk with dirty electricity. We have anecdotal evidence that dirty electricity affects reproduction. However, regarding electrohypersensitivity, we have evidence from diabetes to asthma to multiple sclerosis. What is dirty electricity? The best way to explain this is using water. We all know the difference between clean and dirty water. Water can be contaminated with chemicals, microbes, physical debris, and electromagnetic frequencies. When it comes to electricity, clean electricity is a smooth sine wave. Dirty electricity is represented by radio frequency noise as the contaminant riding on the 60 Hz signal. Sources of dirty electricity include computers. Clean electricity comes into the computer and becomes contaminated with dirty electricity. Variable speed motors, TV sets, dimmer switches, energy-efficient light bulbs all contribute to dirty power. Dirty electricity can also come from your neighbors and from arcing on hydro poles. You can measure dirty electricity with either a microsurge meter or a green wave meter. Ideally, values should be less than 40 GS units. You can also measure and record dirty electricity with a scope meter, and this is what dirty electricity looks like. The peak-to-peak value is 650 millivolts in this example, and values of 10 millivolts adversely affect dairy cows and humans. The relationship between GS units and frequency and voltage are shown in this graph and will be discussed in more detail later. Here are some YouTube videos and publications on the health effects of dirty electricity, some of which I will share with you today. Tale of Three Schools. School number 1 in Wisconsin was experiencing sick building syndrome. Both teachers and students were constantly complaining of feeling unwell in the school environment. They complained of headaches, sore throat, stinging eyes, and respiratory problems. 37 students with asthma used inhalers daily. Normally, when you think of a sick building, we equate it with chemical toxins and mold. Eventually, the school board spent a summer cleaning up the school. However, when students and teachers returned in September, they still felt sick. The school board then brought in a power quality expert, Dave Stetzer. He found dirty electricity in the school and installed filters. According to the school nurse, after the filters were installed, staff had fewer allergies, were less tired, and the sense of smell returned to one teacher. Students had more energy, no more migraines, and of the 37 asthmatic students, they stopped using their inhalers at school, but still needed them at home. Only 3 students used inhalers for exercise-induced asthma. One of the teachers was feeling cold in her classroom and brought in a variable thermostat heater. Several people in the school started to complain of feeling unwell again. The heater was removed and everyone improved. How many of these common electrohypersensitivity symptoms do you have? We will ask for the number in the next polling question. Remember, the answers are anonymous. Difficulty sleeping. Chronic fatigue. Chronic pain. Mood disorders. Cognitive disorders. Visual disturbances. Hearing problems like tinnitus, heart palpitations, skin problems, excessive nighttime urination. Here's the next polling question. School number 2 refers to schools in Minnesota. A questionnaire was designed for teachers to complete at the end of the school day, documenting their health and documenting the behavior of students in their class. This was done before filters were installed, while they were installed, and after filters were removed. While the filters were installed, overall 34% of the teachers improved, as did 64% of their symptoms. Student behavior in elementary school also improved, and the behavior that improved the most were those associated with attention deficit hyperactivity disorder. Here is the publication documenting the research. School number 3 is a school in California where there was a cancer cluster among the teachers. 13 rooms in the school had high levels of dirty electricity, well above 2,000 GS units. Teachers in those rooms had an elevated risk of different types of cancers, as shown here. All were statistically significant except brain cancer. Here's the publication. And some more polling questions. Not all light bulbs are created equal. I learned that people who are electrically hypersensitive can't tolerate energy-efficient light bulbs. This is how very sensitive people respond to questions about lighting. Their symptoms are much worse with compact fluorescent lights compared to incandescent light bulbs, and this includes both heart palpitations and skin problems. I'm often asked to describe GS units, and so I made a short video to do this. Let's watch.
What are GS units? GS units are used to measure dirty electricity, and they are presented here as a function of voltage and frequency. This research was done by Magda Havas and Ralph Frederick, both at Trent University in Peterborough, Canada. The Graham-Stetzer filter and the microsurge meter were designed by Dr. Martin Graham, Professor Emeritus at UC Berkeley, based on discussions and joint research with Dave Stetzer, a power quality expert and president of Stetzer Electric in Blair, Wisconsin. The microsurge meter is an inexpensive tool designed to measure poor power quality, commonly referred to as dirty electricity, on electrical wires. It works optimally for frequencies between 4 and 150 kilohertz. The microsurge meter on the left shows a reading of 488 GS units. The Graham-Stetzer filter reduces high-frequency transients and harmonics on electrical wires and thus improves power quality. It works for frequencies between 4 and 100 kilohertz. With one GS filter plugged into the same circuit, the dirty electricity drops from 488 to 339 GS units. Why was this range selected for the filters? It was based on Russian research which shows that at frequencies above 2 kilohertz, the energy flows internal to the body and is much more harmful. For this reason, Russian guidelines for electric and magnetic fields are lower for frequencies above 2 kilohertz than they are for frequencies below 2 kilohertz. What levels of GS units are safe? According to our research, levels below 40 have been associated with reduced blood sugar among diabetics and reduced tremors among those who have multiple sclerosis. However, levels below 25 are required by those who are extremely sensitive. The electromagnetic spectrum is divided into different frequency categories, with extremely low frequency at the bottom, followed by radio frequency that overlaps with microwaves and radar. Infrared radiation and visible light complete the non-ionizing part of the electromagnetic spectrum. Ultraviolet radiation, as well as X-rays and gamma rays, are ionizing, which means they have enough energy to break bonds within molecules and to damage DNA. The two frequency bands within the non-ionizing part of the electromagnetic spectrum that have received the most attention include power frequencies at 50 and 60 Hz that fall within the extremely low frequency band, and microwave radiation at the upper part of the radio frequency band associated with technologies used for wireless communication and heating. The World Health Organization recognizes another band of the electromagnetic spectrum classified as intermediate frequency that includes 30 Hz to 10 MHz. Poor power quality or dirty electricity falls within this range of intermediate frequencies. What is a GS unit? According to Dave Stetzer, a GS unit is a measure of the energy on electrical wires generated by high-frequency transients and harmonics and is influenced by voltage amplitude and frequency. What we did. We took a frequency generator, dialed in a frequency from 2 to 120 kHz, altered the voltage, measured power quality using the microsurge meter, and graphed the results. Figure 1 shows poor power quality measured in GS units as a function of voltage at different frequencies. The voltage is measured in millivolts root mean squared. As voltage along the x-axis increases at any one frequency, the dirty electricity increases in a linear fashion. The slope of the lines is a function of frequency, and as the frequency increases, the rate of change increases as well. The values are linear up to 1,750 GS units. Figure 2 shows power quality measured in GS units as a function of frequency measured in kilohertz at different voltages. As the frequency along the x-axis increases at any one voltage, the dirty electricity also increases in a linear fashion. In Figure 3, we plotted voltage along the x-axis against frequency along the y-axis for 4 GS units, 2,000, 1,000, 540 GS units. The equations and R-squared values are provided. Figure 10 shows all three graphs and the equations and the R-squared values within the linear range up to 1,750 GS units for each frequency in Figure 1, each voltage in Figure 2, and both frequency and voltage in Figure 3. Another argument we hear is, but the energy is on the wire and doesn't radiate through the air into the room. If that were the case, how do you explain the following results? We took a fluke scope meter that has 2 channels, and we took a light bulb to measure what radiation was emitted from the light bulb. We took one of the channels, hooked it up to measure what was coming out along the wire. We took another channel to measure what was actually emitted through the air at 0.5 meters from the light bulb. We did this research in a rural area of Wisconsin where there are no cell towers and very other sources of interference in our testing. Everything that is in red is what was coming out along the wire. Everything in blue shows you what was coming through the air. The reason the wire is not modulated in a 60 Hz fashion is because we used a ubiquitous filter designed by Dr. Martin Graham to remove the 60 Hz cycle and then show us just the dirty electricity on the wire. We got this waveform whether the light bulb was turned on or off. When we used a compact fluorescent light bulb, in this case it was a General Electric 15-watt light bulb, this is the spectrum that we obtained. Everything in red is coming from the wire, everything in blue is coming through the air. The dirty electricity in the first example with the incandescent light bulb measured 65 GS units, and this was the case whether the light bulb was on or off. This light bulb does not contribute to dirty electricity. However, with the compact fluorescent light bulb, the dirty electricity jumped to 298 GS units. When we took this light bulb and plugged in one GS filter, this is the spectrum that we observed. With one filter, the levels of dirty electricity on the wire and the amount of radiation coming through the air were both significantly reduced. The dirty electricity dropped from 298 to 26 GS units. And this is what the spectral distribution looked like for the same light bulb. You can see here a number of high-frequency bands that are showing up in the spectral distribution. Once again, when we took that compact fluorescent light bulb and introduced one GS filter, we significantly reduced the amount of energy radiating through the air. What this clearly shows is that the energy radiates through the air and can be reduced with GS filters. For more information about dirty electricity, visit the following websites. Thank you.
Global TV in Canada did a short documentary on light bulbs. This woman has lupus and is light sensitive. When she is exposed to UV light, she breaks out in a rash. It turns out that compact fluorescent light bulbs emit ultraviolet radiation. Several groups, the UK Dermatological Association, Migraine Action, and Epilepsy Action, have all complained about these compact fluorescent light bulbs. They contain mercury, emit dirty electricity, radio frequencies, ultraviolet light, and they flicker. Also, there are problems with spectral quality. Dr. Dieter Josner demonstrates light flicker and explains why we should try to avoid it.
The beginning of artificial light was a normal glowing bulb. The glowing bulb is connected to the main power, which is a vibration of 50 Hertz, which gives a flickering of 100 Hertz in the light. And we know artificial light makes sick. Nobody knows why. But with this detector here, we can find out why. If I switch on a normal glowing bulb here, you hear the sound of a glowing bulb. It is a quite sinus frequency, which is not too bad, but even with this sound, even with this frequency, we realize that artificial light makes sick. But this is not available anymore. The glowing bulbs are going. Now we substitute the glowing bulbs with LEDs. And the LEDs can be used very useful or less useful. Here this looks like a glowing bulb, but it gives an awful sound. It's vibrating much, much deeper. And this here, with this detector you can find out which kind of light is harmful or harmless. It's very easy, but the future of light is absolutely the LED. But LEDs can be, as you see here, harmful or harmless. Some computer screens are harmless. You can see it here or you can hear it here. We have the detector, it's full on, and there's no noise. It's quite the same here. It is the same type, no noise. The same computer screen, the same production, half a year later.
This is a summary of some of our research on 3 types of light bulbs: incandescent, fluorescent, and LED. Incandescent light bulbs produce heat and so are energy efficient, but otherwise they seem to be quite good. And these are the light bulbs I recommend for people who are electrically hypersensitive. Fluorescent light bulbs flicker, emit ultraviolet radiation as well as dirty electricity, and radio frequency radiation. They also have an irregular spectrum. LED light bulbs flicker and they produce dirty electricity and radio frequency radiation. Their visible light spectrum is slightly better than CFLs, but not as good as incandescent. Clearly, the healthiest bulbs are incandescent. I mentioned the light spectrum that you can see here for different light sources. Blue light suppresses melatonin, And the more blue light that is generated, the greater the suppression. And this has been associated with a variety of symptoms: sleep, fatigue, depression, reproduction, cancer, and eye problems. I went to a light conference in Germany a few years ago where they were testing different types of light bulbs. I asked them to send me what they considered to be the best light bulb for testing. What I was sent was a smart bulb that could be controlled by your cell phone. I was horrified to measure microwave radiation emitted by these bulbs at levels comparable to Wi-Fi routers. These light bulbs are unhealthy. They waste energy and they create electromagnetic interference, which is an offense under FCC rules. The fine in this case was $16,000 a day, up to $112,000. So the FCC is concerned about electromagnetic interference when wireless networks are affected, but they don't seem to care about the interference with living beings. Lighting is important from a health perspective. What type of lighting do you have in your clinic? We talked about electromagnetic fields, electromagnetic radiation, and now dirty electricity. But how do these compare from a health perspective? I was invited to give a talk at a building biology conference in Nashville, Tennessee a few years ago. One of the attendees came to tell me that she was unable to remain at the conference because she was feeling ill in her hotel room. Several of us had meters, so we went to her hotel room and found there was a cell tower radiating into her room. The magnetic fields were elevated, and there was dirty electricity on the wires. Someone had an extra box of filters, so they installed them in her bedroom. The next day, she told me she felt much better and was able to remain at the conference. Obviously, this person was sensitive to dirty electricity more than to the other sources of electrosmog in her hotel room. This varies from person to person. We did some research on multiple sclerosis, and I would like to share that research with you. I prepared this presentation a few years ago, but it is still highly relevant.
Multiple sclerosis and dirty electricity. I work with people who have multiple sclerosis and learned that their symptoms are exacerbated by poor power quality, also known as dirty electricity. Dirty electricity is generated by various devices in the home, including computers, compact fluorescent light bulbs, plasma TVs, dimmer switches. It can also enter the home from neighbors who use these devices or from nearby wind turbines and poorly maintained power lines. Dirty electricity can be measured with a scope meter or a microsurge meter. One gives a waveform, the other gives a number in GS units. By practicing good electromagnetic hygiene, and by reducing exposure to dirty electricity, some people with multiple sclerosis can find relief for their symptoms, as shown in these videos. This is a video of a 27-year-old male diagnosed with primary progressive MS 2 years earlier. He normally walks with a cane. With primary progressive multiple sclerosis, disability steadily increases without attacks. Dirty electricity in his home was between 135 and 410 GS units. Ideally, it should be below 40. The video on the left shows him at the beginning of the study. The video on the right was taken 2 weeks later. His symptoms reappear when he spends time away from home. This subject is a 40-year-old female who was diagnosed with secondary progressive multiple sclerosis 13 years earlier. Dirty electricity in her home was very high due to a plasma TV. The video on the left shows her trying to hold her hand steady at the beginning of the study. The video on the right was taken 6 weeks later. Not everyone we tested improved after filters were installed in their homes. How many people with multiple sclerosis are also electrically hypersensitive? Could electrosmog play a role in relapsing remitting MS? Could the absence of electrosmog delay, halt, or reverse the progression of this disease? What frequencies and devices are people responding to? How many electrically hypersensitive patients are misdiagnosed with multiple sclerosis? Symptoms for MS and EHS are similar. These are the symptoms they have in common. Just as some people with MS are sensitive to the weather, some may be sensitive to electrosmog. While there is little we can do about the weather, we can reduce electrosmog in our immediate environment, and we can practice good electromagnetic hygiene. Here are some suggestions. Replace cordless phone with corded phone. Replace Wi-Fi with Ethernet cable for computer. Use cell phone as little as possible and only in speaker mode. Do not use compact fluorescent light bulbs. Do not use electric blankets or water beds. Keep alarm clock radios at least 2 meters from bed. Measure radio frequency in your home and install radio frequency reflecting window film or fabric to shield from external sources. Measure dirty electricity in your home and install filters if values are above 50 GS units. Ask utility to install wired smart meters, not wireless. Do not live in a home within 100 meters of transmission lines or within 400 meters of cell phone antennas. We know that electromagnetic energy affects the nervous system, and the nervous system is compromised in patients with multiple sclerosis. We know that electrosmog affects the immune system, and multiple sclerosis is believed to be an autoimmune disease. We know that electrosmog initiates a stress response and that symptoms of multiple sclerosis worsen with stress. Electrosmog can be an irritant or it can be a toxin to those with MS. The link between electrosmog and multiple sclerosis needs to be explored further.
The final video clip in this lecture is on our research with diabetics.
If you or someone you know has diabetes, you need to watch this short video. Diabetes and electrosensitivity. There are two main types of diabetes. Type 1 diabetes, which is also called childhood onset, accounts for 5 to 10% of all diabetics and is largely genetic. Type 2 diabetes, also known as adult onset, accounts for 90 to 95% of all diabetes and is attributed largely to lifestyle and obesity. I would like to suggest there is another type of diabetes, type 3 diabetes, which has an environmental trigger that causes blood sugar to spike or fall. One of these triggers is dirty electricity. The information presented in this video is from a peer-reviewed publication. Dirty electricity elevates blood sugar among electrically sensitive diabetics and may explain brittle diabetes. In this document, I present the results from 4 case studies. The first example is a 54-year-old male who was diagnosed as pre-diabetic. What is interesting about this case is that his blood sugar remains normal when he's fishing or out in the woods, but when he's in a built-up area near power lines or working on his computer, his blood sugar increases. As part of this study, case number 1 measured the amount of dirty electricity in his home, shown in blue, and his blood sugar, first thing in the morning, shown in pink, for 9 days. His blood sugar should be at or near the red line. Instead, what we find is that the higher the levels of dirty electricity in his home, the higher his blood sugar. On one of the days, he started working on his computer before he measured his blood sugar, which was higher than normal. He moved away from the computer, waited 10 minutes, and measured his blood sugar again.
This time, his blood sugar dropped by 20 milligrams per deciliter, or 1.2 millimoles per liter, in just 10 minutes. This man is electrically sensitive and is a type 3 diabetic. If your blood sugar changes in different environments, you might have type 3 diabetes. Case number 2 is a 57-year-old female with type 2 diabetes. She uses exercise to control her blood sugar, shown here in pink. Her exercise of choice is walking. When she goes for a 20-minute walk at the mall after hours, her blood sugar drops significantly. The gray bar shows her blood sugar before walking, and the green bar after a 20-minute walk on day 1, day 2, and day 3. Sometimes she walks on her treadmill. This time, her blood sugar increases as shown in blue after a 20-minute workout on day 1, day 2, and day 3. This woman is responding to the dirty electricity generated by her treadmill. She is a type 3 diabetic. If your blood sugar increases when you use electric exercise equipment, you may have type 3 diabetes. The treadmill test may be a good diagnostic for electrosensitivity among diabetics. Doctors need to be made aware of this so they can prescribe appropriate exercise for their patients. Case number 3 is an 80-year-old female with type 1 diabetes who takes insulin twice a day. Like most people, her home has dirty electricity, which was reduced with special filters. She measured her blood sugar first thing in the morning for 1 week before filters were installed, and then for 1 week with filters. The filters significantly reduced the dirty electricity in her home by 98%. Her blood sugar during this period dropped by 33%, and the amount of insulin she required was reduced by 75%. This woman is electrically sensitive. If you reduce your exposure to dirty electricity and require less medication to regulate your blood sugar, you may have type 3 diabetes. The fourth and last case is a 12-year-old male who had elevated blood sugar and was rushed to hospital on December 30th, 2002. His blood sugar was well above acceptable range. This graph shows the amount of insulin he took in blue and his daily blood sugar in pink. While in the hospital, he was given insulin, but his blood sugar continued to climb. On January 1st, his blood sugar began to drop and he was allowed to go home. As he increased his insulin injections and his blood sugar continued to drop, by May 9th, he had reached the acceptable range and his blood sugar was beginning to stabilize at 77 units per day. During this period, he took 12 sugar pills. On January 14th, filters were installed in his home to reduce the dirty electricity. The very next day, his blood sugar began to drop to the lower part of the acceptable range. His parents reduced his insulin injections and his blood sugar stabilized at 37 units of insulin, about half of what he was taking a few days earlier. During this period, he consumed 125 sugar pills. Some doctors will tell you this is normal for those who are first diagnosed with diabetes. They call it the honeymoon period. However, in the same household, a younger sister who had lived with diabetes since the age of 3 months also had to make downward adjustments to her insulin when the power quality in their home was improved. This young man and his sister are both electrically sensitive and are both type 1 and type 3 diabetics. Do you have type 3 diabetes? Does your blood sugar increase after using electronic exercise equipment? Does your blood sugar suddenly spike or fall for no obvious reason? Does your blood sugar change in different environments? Do you have difficulty regulating your blood sugar, and has anyone ever told you that you have brittle diabetes? If you answered yes to any of these questions, you have type 3 diabetes. So we may well have 3 types of diabetes, one that is mostly genetic, another controlled by lifestyle, and a third influenced by the environment. What can you do if you have type 3 diabetes? You can test your environment for electromagnetic pollution. You can minimize your exposure to electronic equipment, and you can share this information with your doctor and others who have diabetes. For more information, visit the Electrosensitive Society or magdahavas.com. Please share this information with those who have diabetes and with their doctors. We need to know what the environmental triggers are and what percentage of diabetics react to these triggers. Thank you. And now for our final two polling questions. The next lecture is on ground current pollution after a short break.